Hi, I'm Dr. David Pratt, the Commissioner of Public Health Services for Schenectady County. And I'm taking time today to speak with you about the upcoming influenza season. As you can imagine, I've been spending a lot of time lately thinking about influenza and working with the county schools, with Ellis Medical, and with the private practitioners to make sure that we're really ready for this season. Frankly, there's been a lot of confusion. And let's not confuse the flus. There are really two influenzas that we're going to be concerned with this year. First is the usual or seasonal influenza. Now that's an illness that occurs every year, usually in the autumn or the wintertime. It presents with a fever, frequently a cough or a cold, and achiness. It's pretty predictable. It occurs almost every year. And that particular illness we build a vaccine for in the spring and deliver it in the fall. That vaccine is designed for people who have underlying medical problems, the very young and the very old, and pregnant women. Now that vaccine is available in many places right now, and I encourage you to get that vaccine that protects against this seasonal flu. In addition, once every 30 or 40 years, an unusual, brand new kind of influenza emerges. That's the so-called pandemic flu because it spreads rapidly around the world. This year we're seeing the so-called novel H1N1 or swine flu emerge and infect many people across the country. Now the reason it's called swine flu is because inside the gene of this particular virus there actually are genes that come from pigs. Seriously. It turns out that both humans and pigs can be infected by the influenza family of virus. The one that is causing problems this year is adapted so it can make humans quite ill. Now, presently we don't have a vaccine available to us. We anticipate that in early or middle October the vaccine will come, and when it does come, we want to make sure that there are 5 groups that pay special attention to those announcements and get that vaccine. The first is women expecting babies. The second is caregivers of children less than 6 months of age. The third is school-age children from those above 6 months through age 24. And then healthcare workers who are the frontline forces against the flu. And then finally people 25 and over who have an underlying medical problem of one kind or another. But even before we have the vaccine, it's important to know there are 3 things you can do to prevent the illness in the first place. The first is careful hand washing and frequent hand washing to interrupt the transmission of the virus from one person to the next. The second thing is covering your cough, if not with a tissue over nose and mouth and dispose it rapidly, into your sleeve so that you don't broadcast particles of flu to other people. And then finally, if you should develop fever and or cough or a sore throat, please either stay home or if you're at work or school, go home so that you don't infect other people. The good news is with this particular kind of H1N1 or a novel influenza that it's clinically mild and that most people who are ill can treat this flu at home. The way you treat it at home is with rest, with fluids, and with Tylenol or ibuprofen. Please remember that we don't want to treat with aspirin, especially in children, because of some peculiar side effects that can occur. Now I want you to continue to be alert. Some of my advice and comments may change over time, so please be watching the news and also visit our website www.schenectadycounty.com. This vaccine, when it is available, should help us interrupt the problem that we potentially will see in our community. And with your help, we're going to try to make this the mildest flu season possible. Thank you very much for joining me.